6:14, October is Breast Cancer Awareness Month, and today is Metastatic Breast Cancer Awareness Day. Now, we've come a long way in the fight against breast cancer, but for metastatic breast cancer, there is no cure.
There is, however, hope and treatment. 10 News side Stephanie Hudson has more on patients and doctors battling breast cancer.
Metastatic cancer is when it spreads, usually to the liver, lungs, bones, or brain. Usually this happens months or years after someone's treated for breast cancer, but in about 6% of women, they get that diagnosis first.
I woke up one morning and the right side of my right breast was completely hard. I had no idea why. I just knew it wasn't a good thing.
Angela Farrell's cancer is aggressive, often missed on mammograms. It lays across her breast, unlike a typical lump.
When he came in, he told me that it was metastatic breast cancer, and I also had bone cancer.
Jeanette Demko was first diagnosed with breast cancer in 2015. It metastasized years later.
And I don't even want to know where it is.
These women are living proof that metastatic breast cancer is no longer an automatic death sentence.
There is hope.
Dr. Christina Alencar says for every 10 patients she sees, 2 or 3 have metastatic disease.
More women are living longer with good quality of life.
About 1/3 of women live at least 5 years after diagnosis. Some live longer.
If we don't know yet how to treat that type, or the best way to treat that, we can enroll patients in clinical trials.
Currently, Virginia Oncology Associates has patients enrolled in nearly a dozen breast cancer trials. Angela's cancer is treated with medication.
They told me I would deal with that for the rest of my life. But I have the rest of my life.
Playtime is now a priority. Her painful bone cancer sometimes makes it difficult to walk, but Angela doesn't complain. Jeanette is also focused on living her best life, staying active with the Brouhaha and exercising every day.
I don't like to walk outside. I like to walk around Target.
Me too. She is on her 3rd kind of chemo, keeping the faith and remaining fearless, which, when it comes to breast cancer, is just what the doctor ordered. That's right. Don't be afraid, Dr. Alencar says, about the mammogram that could save your life, or even a diagnosis of metastatic breast cancer, because there is hope and new research. In the newsroom, Stephanie Hudson, 10 on your side.